Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. We have an extra special celebrity guest today, Dr. Gia Merlo from New York University, NYU. She is a leader in lifestyle medicine and a champion of the nursing profession. She spearheaded a massive effort over the last few years, bringing together a number of experts and leaders in lifestyle medicine and in nursing to write and co-edit the first ever lifestyle nursing textbook, which was recently released. And that's amazing. She's done so many things. She is a board certified psychiatrist as well as board certified in lifestyle medicine. She also has a master's in both business and education. And a very exciting thing that's happening now is she is the founding chair of the Lifestyle Caucus of the American Psychiatric Association. Congratulations for that. That's amazing. And I want to just put some bullet points out there. I can't possibly encapsulate everything that Dr. Merlo has done in her life and her profession, but I just want to name a few. She's an author. She's a clinician. She's an educator. She's a mentor. She is a lifestyle medicine leader, like I said. She's a fellow of the American College of Lifestyle Medicine, which means she has dedicated her time and effort to that. She's been the chair of ACLM's Mental and Behavioral Health Member Interest Group, called the MIG. She serves on the board of directors or has served on the BOD for many nonprofits, currently serving on the BOD for the Plant Powered Metro of New York, PPMNY, and the advisory board of the General Positive Health Institute, the GPHI. She's been faculty at a number of really great places: University of Pennsylvania School of Medicine, Baylor College of Medicine, Rice University, Texas Children's, and Children's Hospital of Philly. Within academia, of course, you've heard she's done so much. She's a clinical professor of nursing and a senior advisor on wellness. And she also serves as a clinical professor of psychiatry in the School of Medicine. So it sounds like you're in both places, which is awesome. She's also adjunct faculty at Johns Hopkins. So I think you've probably cloned yourself and done all these things. She is just a leader and a champion for us. We are so happy to have you here with us. She is a leader in our profession. We all look to her and look up to her and really want to be able to achieve half of what she has achieved in her career. So thank you so much for being here, Dr. Merlo. We're so happy you're with us.
Oh, Susie, thank you so much for that generous introduction. I'm a little nervous now. I have to live up to everything you just said about me. I don't know. Maybe I should stop while I'm ahead. How about that?
No, this is perfect. You're perfect just like you are. So we like to start off a little bit, and maybe you can be brief just about how you even got into lifestyle medicine. What made you even discover it? Were you practicing that in your life? Were you always passionate about prevention? Did something happen in your life? Tell us the origin story.
Oh, that's a great question. And I have a few versions of it. So it depends on how far, but see, I'm a psychiatrist. I have a lot of stories about everything. So unfortunately, you asked me a question that I'm going to distill it down. So technically, I have been practicing what now I'm calling lifestyle psychiatry for my patients for about 30 years. I didn't know it was a thing because there would be parents that would come to me and they'd say, my child is ADHD diagnosed. And they're like, and I don't want meds. And I'm like, okay, that's all we know. But then I would figure out a way to do lifestyle interventions and then get to a place where, oh, they got better. And then on top of it, I think there were a lot of those things that I started learning after time that it didn't mean all or nothing either way, that you could do both. There are patients that do need the medications, but then you can also do the lifestyle interventions on top of it. And sometimes that decreases the need for medication. So that's the long story. The shorter thing is I was teaching a course at Rice University, and one of the modules I taught was on nutrition. And I had done this research, and these are really bright kids. They all perfect SATs and ACTs, and they're just really bright kids. And all of them were valedictorians of their high schools. And so they were sitting in my class, and I got a little nervous. So I had to really study a lot to teach them. And I developed this module on nutrition. I must have spent thousands of hours researching it because I was a little obsessive that way. And then I got a book contract for Oxford University Press to write the book on the course I was teaching. And I had never published anything in my life. I was a clinician. And then I got really nervous. And then I asked my office manager, I said, look for places that I can go to learn about this. And then she says, Dr. Merlo, there's something over in DC that sounds like something you're doing. And it sounds very similar. And I listened to this guy and he's saying the same things you say in class. So why don't you go? And that's when I went to Neil Barnard's International Conference on Nutrition Medicine. And then I was sitting there and I was saying, okay, this is home. And then I found out about ACLM. I joined. I had 1 month to study for the board exams. I did that. And the rest is history. And it feels like home.
That's amazing. And I know you could probably tell us all kinds of phenomenal stories about patient success and colleagues and all of that. I know we really want to make the most use of your time if we can. And so tell us a little bit about the things you're passionate about right now, what role you're serving in. And of course, we're here as nurses, so we would love to hear how you've worked with nurses, your role in the School of Nursing, and how that comes to life for you.
Beautiful. Thank you. So when I moved to New York University in 2019, I had this opportunity to teach in the nursing school, and I was really excited about that. For me to be able to, I was teaching at the undergraduate level at Rice before moving to New York, and then I said, this is brilliant to be able to teach in the nursing school and learn, because I really remember the first nurse that taught me was when I first was a resident, and she taught me so much, and she was the charge nurse in the emergency room. So I learned so much from her, and I was like, okay, now I can go and learn what they know, learn what I can give, and it can be a collaborative experience. And that was similar to what my first experience with a nurse was. It's been brilliant because I teach graduate nursing school. And what happened was I was asked, the pandemic happened as soon as I started working there. And then they asked me to do wellness weekly visits with the nurses. And I did that. And then they all gave positive feedback. And then from there evolved this lifestyle nursing. And I called it lifestyle medicine. Back then I was scared to call it lifestyle nursing because I didn't have the book yet, but I called it a lifestyle medicine book. And I developed this course for the graduate students, and just really amazing educators these nurses are that they taught me, because all of them have a lot of experience in the bedside. And they also, many of them were in education as well, in the education track. So PhD students, master level students. And I then realized what they needed, and they realized what I could offer them. And a lot of that was the evidence in what we call lifestyle medicine. But then through that process, I realized we need a book, because they have an engagement with the material in a very different way than a physician does. And I think that's really what the spirit of the lifestyle nursing book is about, is helping nurses to engage from their education from wherever they are, whether they're a bachelor level education or advanced practice nurses or PhDs. It doesn't matter, because we wrote it in a way that there's enough in there for all of the nursing spectrum of whatever their scope of practice is. And I think is really what I learned the most from teaching. And it's funny because I had some of the professors from the nursing school write chapters in the book as well. And when they were learning about this, so they had never heard of lifestyle medicine, right? So there's these people, and that was the most exciting part of this book process for me. I was calling people and nurses from Stanford. I was calling nurses from Johns Hopkins and talking to them about what this lifestyle medicine field is and what lifestyle nursing is. And more than anything else, they were like, oh, that sounds like something's interest of me, that I'm interested in this. And so then the conversation started evolving. And that's how then I got the co-editor, Kathy Berra, on board. And she was very instrumental in getting many of her colleagues. She's a luminary in the field in cardiovascular health. She was editor of multiple journals. So she was just a brilliant partner for me. And of course, Deborah was there as my editorial advisor, which every time I needed my wrist lap for something I wasn't doing right, Deborah was there to make sure that I heard it. So I owe such a debt of gratitude to her as well.
I love that. So can you tell us a little bit about that book? You told us a little bit about the genesis, and you mentioned there's a couple things that you said. One was that you discovered that nurses come at this whole thing from a little bit different perspective. You also made commentary about how you also learned from nurses. They, I'm sure, learned from you at the time, but how we can be collaborative in that way. This is an interdisciplinary team. It takes all of us to bring lifestyle medicine faster, further, and impact more people. I don't know if that really asks a question, but can you just highlight the difference with nurses in particular?
Sure. So I think Deborah was really helpful in teaching me about the nurses code and how that's very important, and the educational changes that are going on in nursing education as well. And I think that when we think about Florence Nightingale, we think about the evolution of nurses and where we came from. I'm sorry, I talk like I'm a nurse, so I do this as I teach as well. So that's how I teach. I'm sorry. I automatically went there as I have to, otherwise it doesn't make sense. So the evolution of, I'm sorry, I'm gonna have to speak in we's. Just pretend for a while that I'm a nurse, okay? In spirit, I'm there with you. Thinking about how we've evolved to what we're doing now, there's been so many changes in what physicians' scope of practice is and what they do, and insurance and the healthcare system and the way that we operate has phenomenally changed over the last 30, 40, 50 years, and even 10 years, right? And the same is happening for nurses. And I think it devolved for a while into not allowing nurses to do some of the things which is part and parcel of what they can do. But what I realized is that nurses at some fundamental level sometimes don't even know what they can do and what their scope of practice is. And part of the education process is sometimes I'll assign for my students, let's go back and see what is in your scope and come back and let's talk about that next week. So you're an advanced practice nurse, your NP program, so let's see what you think your scope of practice is in this field and come back to me and let's talk about it. And it's interesting because they learn from that as well and what they're able to do. And that's why I think this book was pivotal, because every chapter is written by nurses, okay? And there may be co-authors that are physicians, and they may be some that are not written by nurses, but people that are intimately involved in nursing education. So I think that allowed us to put in this book a lot of information that is really speaking generally to where nurses are starting from in their education and what they can learn further. So physicians may start from a certain place. Nurses, and whether they're staff or advanced practice, they absolutely come from a different place. And I think it's mostly coming back to the the nursing code of ethics. And it's also this whole concept of health promotion that's taught in nursing education a lot more than it's taught in medical education. And I think that even though that's from a system and a general populist sort of level, then taking this and intimately for the individual person is a different frame. In my class, everyone has to look at themselves in addition to the patients that they may serve. And that tends to be the most impactful part of the class. And we do that on multiple levels. So for each module that comes up, then they have to do a reflective piece, a reflective writing, and talk about where they resonated or not with the material in their own personal life.
I love that. And I think that is a key piece. And when I was reflecting on my own education, I went to a beautiful school. I love my alma mater. I feel like that piece might have been a little bit missing, like the reflective piece. How does all this apply to me? Having it, even self-care, that kind of thing. But I want to go ahead and send it over to Deborah. She can introduce the Future of Nursing report and get your thoughts about that kind of thing. So Deborah, you want to take over?
Oh, thank you so much. We wish we had hours with you today, Dr. Merlo. So one of the things that we're hoping to do is to have generative conversations about the landmark report, The Future of Nursing 2020-2030, which comes on the heels of the report prior, the 2010 to 2020. This one was informed by the COVID pandemic that shone a bright light on the social determinants of health, and therefore was really focused on charting a path to achieve health equity, again, with the focus on nurses being able and positioned to and having a paradigm which helps them lead on this. It says nurses are trusted bridge builders who champion good health for all, and the report explores how we can and must unleash the power of the nurse to achieve health equity, and how systems that nurses function within must do more to educate, pay, employ, and enable nurses to support them so they can do more. And I just want to share that with just as one individual and educator, physician, leader, you have done so much really to actually do this very thing, which is to help support nurses. We are going to be in Denver at a conference with passionate people dedicated to addressing many of these things: sleep, stress, food, healthy food, and all. And wondered if we might just have a conversation around how you see these communities, these two passionate communities, linking up, sharing a synergy, what we can do coming out of this conference to move this forward for nursing and lifestyle medicine and the future of nursing.
Beautiful, beautiful. Great question. Oh my goodness. So there's so many aspects of this that I think are really pivotal. But I think just to start the conversation, the way that I'm conceptualizing what we need to do and how we need to move this forward is we are all members of a team, and our job is really towards our patient individually. And that's where the space we live in lifestyle medicine and lifestyle nursing, right? It's the individual patient and in concert, the individual nurse, okay? Because we have to take care of ourselves in order to take care of our patients. But putting that aside for a second, in the healthcare team, everybody needs the education. Everybody needs to understand these, and we need to all be able to have these very important conversations with our patients. We know we're not doing well. We have that epidemic of loneliness that we talked about, the U.S. Surgeon General put out. We have so many aspects, and I like to expand that. I don't like to just stay with the loneliness. I think the connectedness is the way that I like to frame it, because I put in there religion as well and spirituality, which are things which we can talk about. And those are chapters in my book in Lifestyle Nursing, is how do we talk about these things with our patient without being biased, because they want to hear about it. 80% of the populace believes in God in a religious sense, and more than that in a spiritual sense. So these are things that people rely upon themselves. So we need to be able to understand that's important for our patient, but do it in a way that's not violating any ethics or their autonomy. And so that's one of the reasons I included that in there. And that's a connectedness. It's a connectedness in a holistic way. But just to get back to the team, physicians, nurses, dietitians, chaplains, whoever's a member of medical assistants, even our secretarial staff, they all impact on what happens with a patient. And in order for us to be able to maximally help any individual patient or even the population, we all need to have the education, and we all need to be able to dovetail the interventions, right? So if a nurse says something to a patient, they need the education to be able to say it. And that's one of the reasons we're teaching this now and have developed some academic scholarship around it. But then it needs to follow with the physician saying the same thing. We need to follow with the phone call if they call the secretary, reverberating the same sort of the nuanced sort of thing that these are things are important. Stress is important. We need all of us to be on the same page, and we need to be able to team tag it. And there's plenty of space for everybody. I think when I talk to my physician colleagues, the first question is, why lifestyle nursing? Why did you lifestyle nursing? And I said, there are 4 million nurses there. We have 1 million physicians, and it's eye-opening to know that there are 4 million nurses. Just think about how much impact each one of the nurses can have in their lifetime if they have this education, are able to have these conversations. Now, of course, the staff nurse needs to be in sync with the team. And we're very aware with the scope of practice, meaning they can talk about these things, but it can't be it has to be in conversation with the team. Whereas the advanced practice nurse, they're out there doing this stuff anyway. So they need the education to be able to have these conversations. So I really believe that the time is now to stop thinking about us as separate sort of entities and really work together. I know that this is a space, and this is about conversations. This isn't about procedures. This isn't about education around procedures and cutting appendix out. We're talking about basic education on lifestyle interventions, which we know affects both mental and physical health bidirectionally, and also affects, as we all know in lifestyle medicine, 80% of chronic diseases. But the data around how much mental effects and the gut microbiome and inflammation, people that I treat get that their mood gets better, but their arthritis gets better. So they're like, how is that possible? Yeah, because they're all interconnected. And maybe this sort of siloed approach to disease isn't really the way we need to go, just like this siloed approach to who takes care of the patient isn't the way we need to go.
Thank you so much. That's so beautifully put, the siloed approach to these conditions and the siloed approach to our team and who's treating the patient. Thank you. So taking that to the next step and creating this team, we're all going to be together in Denver. If you imagine this and your intimate work in the nursing department, you're being the editor of this comprehensive lifestyle nursing textbook that nurses can learn from at all levels. And now we're so lucky we have lifestyle medicine 5.5, 5.5 CME that can even be rolled out at all levels. So there's this really a growing number of resources for knowledge. And yet we are still siloed, and we are hearing from physicians that it would benefit their practice in their clinic to have nurses, to have other people, and particularly nurses, also being a part of this education, assessment of the patient, the whole patient. How would you envision us moving this forward so that we can do more of this? Because I see us really ideally wanting this on all sides, physicians and RDs and nurses, and yet we are finding that there are sticking places. And of all the people that walk in these both worlds, Dr. Merlo, you have such a lens on how this might happen.
Yeah, it's complicated. So I think I tend to see the cup half full. So we can talk about the blocks, and I'm writing a book on blocks right now, by the way. It's a psychological block. So we can talk about internal and external blocks. And that's in my wheelhouse right now and what I'm thinking about every day. But I see what we're doing is it takes time. It took us 40 years from the time that we had the information on the carcinogenic effect of tobacco smoke until it became available to the general population. And we're now moving things faster than that. So it's not going to take 40 years. We have the first lifestyle nursing book, and now we're going to start moving it together. Look how much ACLM has done in such a short time under Susan Benegas's leadership. So there's so many things that we can say that we're doing. I think, to me, the step one was getting the nursing book out there, okay? Because now people can take that and then do other books. We need 50 nursing books. We don't need one. We need everybody. And people, I say, do you mind other people? Are you kidding me? That's the way we need to do this. Everybody should go out there and do that. But I think the other point is now we have a whole section in the lifestyle medicine textbook on nursing practice to try to help the physicians that read that book get educated as well on what nurses can do. But the whole process of me getting that section in the lifestyle nursing, lifestyle medicine fourth edition was an entire another conversation that we can have. I think it's education. It's education first and foremost, because I think people just have misinformation. And I think we have a lot of misinformation with social media out there on multiple levels, on multiple things, including what we can and can't do. And I think if you take a step back from this, because there's so much angst with physicians in what's happening in healthcare, you get 5 minutes with a patient, you have to do doc to docs with everything you do. You prescribe one medication one month, the next month that's not covered by the insurance. You do pajama charting, you have 3 to 4 hours of charting every night. Those things cause a lot of stress, and physicians and nurses, 60, 70% of them are feeling burnt out. So when you have that much stress and you feel something is changing, it's easy to target that as a problem, but it's not. And it comes, and this is the half full conversation, it comes to people honestly because they're just stressed and nobody has the bandwidth to figure out why they're stressed, because they are, and they know it's work, because these are burnout as a work-related construct. So part of the conversation is just getting people in the room, doing the education, having competent nurses in the room talking about these things, not from an antagonistic point of view, but more from a let's learn from each other point of view. And I think that once you're able to understand empathically why they're that way, I think that's the first step in getting to the next level. Because if you had your entire what you were doing for multiple decades, Medicaid, we're the only industry providers right now that every year Medicaid pays us less and less. So our salaries go down every year, or we have to see more patients to keep at the same salary. So if you get 20% less salary one year, just think about what that does to your budget. So then you're seeing these nurses come in taking over patients and you're like, they're the problem. But that's not that simple. It's a bigger problem. It's a bigger problem. We all need the education. We all need to make sure everybody has the education, and we all need to figure out a way to work together because there's enough work for all of us. There really is. The fact that we only have 5 minutes with the patient may be the bigger problem, not the scope of practice of what nurses are doing when they're talking about diet and exercise and stressors with patients.
Thank you. Cognizant of time, may I ask, before I turn that back over to Susie, 2 quick things. Can you tell us briefly about the upcoming Dr. Rippey's 4th and what's going on with that, and anything you'd like to share also about the books that are out on their way, and how they tie in with all of this beyond just the nursing conversation, just having these conversations, because it is all, like, as you're saying, it is all connected. So we'd love to hear about those.
So the lifestyle medicine, it's 1,500 pages in the 3rd edition. One of the things that I really focused in with the editor of that is Dr. James Rippey, and I'm the associate editor of the American Journal of Lifestyle Medicine. I work closely with him, and one of the things that it took me a while to really warm him up to the idea that we needed 2 extra sections that we didn't have before, and one was on psychiatry and one was on nursing. So we've added those 2 sections to this encyclopedia encyclopedia of a book that really is the resource of all lifestyle medicine. And that is exciting. So that should be coming out in the spring, should be coming out shortly. And the two books that I have coming out, one is my passion project, which I'll tell you last, but the other two books, I was asked by Oxford to do a second for my first book on medical professionalism. And now I have a whole big encyclopedia of medical professionalism. And in there's a chapter on lifestyle medicine. So that's really exciting. Therefore, trying to take it into that sort of evolutionary of UME and the GME, the people that are teaching in medical school and in residency, so they can get a taste of what that means in that chapter. And then the other book, which is Lifestyle Psychiatry Through the Lens of Behavioral Medicine, that's a textbook. And that's going to be coming out in December 14th, 2023. It's again a textbook like Lifestyle Nursing is, but this is about things that we haven't really approached yet in lifestyle medicine, and taking the behavioral medicine approach, psychology, what we know, merging those two things. I found a co-editor who's a brilliant PhD researcher who co-edited that with me and really took his expertise and his colleagues and brought them into the fold. And because I was so excited of what I learned through that process, I decided to take that information and plus add my own personal narratives and my experience from 30 years of working with patients to do a general reader book, which is going to be out. I'm actually launching it tomorrow, but it's going to be out in between March and May 2024. And that's called Unblock Your Brain: Total Health Through Lifestyle Psychiatry. And basically talking about the blocks that we have, because everybody knows we need to exercise more. Everybody knows we need to eat well, but there's so many of us that fail, multiple Weight Watchers, new. We all go in this roller coaster, and I'm included in that. And how do we get to a point where we can understand what's going on? And the science has evolved to such a way that now we're able to connect these behaviors in personality, in cognitive ability, in external barriers as well, and track them to what's happening in the brain, and really be able to say, through this book, I'm developing tools and other ways to actually help yourself and your patients get past some of these barriers that we see. And then the last half of the book is lifestyle psychiatry. So taking that into the pillars of lifestyle psychiatry and being able to use them in different interventions and giving the foundational understanding for the general reader on why we need to do this. So it's called Unblock Your Brain: Total Health Through Lifestyle Psychiatry.
Wow, thank you so much. And how powerful, because really one of the underpinning themes to this conversation has been about removing these blocks, about communication with one another, about we're all on the same team, and that change takes time and it can be uncomfortable, but to come from the right place and work together. So thank you so much for all of that, Dr. Merlo. While Susie's spending these last few minutes, I'm going to grab the Lifestyle Nursing book from back there because we just have to have a moment to share it too here on the camera.
Okay. If you had, Dr. Merlo, if you either had a magic wand, what would the future look like? And included in that any very specific advice that you would give nurses or your physician colleagues or dietitians, the healthcare team, anything in the lab?
Physician assistants included in the next.
Oh, yes, physician assistants. Yes. Yes. Don't forget them. Yes.
Okay. Yeah. So I think, good question. I think the most important thing that I've learned in my life, and I'm talking like an old person because I am, but it's okay. It's experience. But it's really about being open to learning new things and being open and receptive and being curious. So approaching as an expert versus approaching with curiosity. So the flexibility and the ability to be open to new things are really important. And I write about that in my text of my book that's coming out, To Block Your Brain. But I think just that in itself is the beginning of the conversation. So if you go into conversation already struggling with that, I know that when I started this whole approach of doing this book of lifestyle nursing, I heard a lot of negative things come my way. And still to date, there's a lot of people that don't want to acknowledge that I actually had a part of it. And I think that it's really unfair to themselves. And I feel sorry for them that they can't embrace it. This is helpful for everyone. When we are working, we are just here, whatever your bent is, but I feel like it's a blessing to be able to have the opportunity to serve others. And in order for us to learn and grow, because stagnation is death. So as long as we keep growing and learning, we're going to be able to appreciate what others are doing. And if you don't even agree with it, at least they're moving the needle forward, because academic discourse and talking is how we all learn. And unless we have different opinions or different people there, we're not going to grow. So we need to be open and flexible.
I love that. I've been embracing curiosity much more as I go through this profession. So I love that you said that. And Deborah, do you want to show us the book?
Yes.
Really quickly.
We can't go without. I know it's going to look backwards on the mirror.
Over your head.
See it?
I can.
Do it. Yes. Yeah. Can you see it? Yeah.
It's beautiful.
Okay, perfect.
And,
now I can.
That's really poignant, as just sharing about that people can feel uncomfortable that you were so intimately involved as a co-editor of this book on all sides, wherever that is, because it is this block, it is this siloing. And I think one of the biggest takeaways from this conversation is about being unblocked and connecting and communicating. And we're just forever grateful for this, as is shared here today in this conversation, this interview. It's these kinds of foundational documents and works that will be able to inform all of nurses about what they can do and about lifestyle medicine so that they can practice with the science. And then moving forward to the Dr. Rippey 4th edition, where nursing is now a part of that
conversation. Yes. Yeah. And we have to end on the half full here. So I also have been getting these beautiful emails, beautiful connections with people saying, this changed my life. I've read every word. I now can integrate it into my courses that I teach. I've given it to 5 of my friends. I've heard the most loving, generous conversations coming from nurses my way. And I'm so grateful for each and every one of them. So I'm glad to be able to do something. And I just want you all to blossom. And I want us all to be able to just do what our passions and what leads us forward. We just have this one life. So let's do the best we can for our patients and for ourselves and each other.
Thank you. We know you have to go. It takes an enormous amount of courage and humility to be a physician, not just any physician, a psychiatrist, and move into the School of Nursing to teach nurses, and then to do this. Really, it is the way we need to be, as we're discussing here, and so thrilled about all of the ripples out that keep coming back with the gratitude and the stories. Thank you so much.
Thank you. Thank you. Thank you both. Thank you for this interview. It was so much fun. Lovely.
I was just going to say that we appreciate her being with us and know you have to go. And we are so thankful. So thankful.
Thank you. Thank you.